Welcome to Open Wide. Dr. B, I have a couple questions for you. Um, First question, what percentage do you think in our office do our patients actually floss every day?
Um, Percentage-wise, I would say probably 20%.
And what do you think about the other 80%?
The other 80% actively,
Exaggerate.
confidently exaggerate and probably lie about their habits.
And how would you know that they're lying? How would you check?
It's not about more lying, but I would say they don't want to look they don't want to look bad in front of the doctor. So, they always answer, yes, I floss. However, the follow up question has to be, how often do you floss? And that actually gives up the true colors. And most of the time, patient goes, every other day, twice a week, every once in a while. And that's so important because that pretty much links to their most of their oral condition.
It's such a small habit, but it's so important for your
Yeah,
well-being.
big time. Because I've seen patients brushing religiously. They're doing great job with brushing, but just because they're missing that flossing, they still end up with cavities or gum problems. What we need to make it clear to the patients that brushing is like half the job. You have to floss because flossing is what cleans between the teeth. Those hard to reach areas where the bristles of the toothbrush doesn't get to.
Mhm.
And if you're not using a water floss or you're not using the floss picks, um, those food particles turn into cavities.
I actually heard of something called the airflow. Can you elaborate more on that?
Airflow is one of the new technology that we have in our office, and what it does is that it makes the cleaning, the process of dental cleaning, so much more efficient and so much more comfortable for the patient. What it does is that basically it cleans not only the plaque but it disrupts the biofilm, and that makes it harder for the plaque to come back. And we recommend that for every patient at least twice a year, every 6 month checkup. And so far, we've been getting very good feedbacks from it. People love it.
Gotcha. So I'd like to discuss teeth whitening and the
Okay.
hype over it. Let's talk about the obsession over it. I see all these TikTok trends. Can you elaborate more on?
So, tooth whitening is a big industry because people concentrate on instant gratification. They want to see instant results. I cannot tell you how many times I have patients come to me and they have other issues going on, but their number one priority is whitening their teeth.
And what is this TikTok trend that I saw? It has to do with baking soda and lemon. Does that
Yeah,
actually work?
that's pretty much like a recipe for disaster, mainly because there are a lot of products out there, and what our viewers, our patients need to know is that most of them have no control, no overseeing power, meaning they can literally put anything in that product, and
What would
there's gonna
what would you recommend in your office?
So there are a couple options that we can recommend to our patients seeking to get whitening. First one will be in office whitening. Basically, it's 30-40 minutes of treatment where we whiten the teeth up to 3 shades up. This is the safest way because we use the product that's actually biocompatible and it doesn't cause sensitivity. Or second option is that we make custom trays for the patients and we give them the product that they can use at home, and that will be continuous kind of treatment. They can do it on their own in the period of a year, two, doesn't matter. But what I want to emphasize is that you are responsible for your own health. You are responsible for all the products and all those TikTok's advertisement.
How does it affect you negatively? The trends that you see. What impact does it have on?
So we see a lot
on
of
the teeth?
patients coming back with hypersensitivity. The usual talk goes, "Hey doc, I use this product and my teeth are so sensitive I cannot even talk. Every time I'm drinking, eating, even when I try to open my mouth, that air irritates me. I get so sensitive. What do I do about it?" And it's a tough situation because the damage is already done. We can do some reactive procedures to it, but the best way to deal with it is to avoid it. The natural shade of teeth is rarely that Hollywood white, okay? It's okay to have a little bit of color to your teeth. It doesn't have to be that blinding.
Toilet bowl white.
Yes, thank you.
How would you approach that?
Look, you need to understand that going to a dentist, it creates some kind of stress, okay? You can call it years of, television programming or horror stories, but people are already nervous. They're already stressed. And on top of that, you need to consider that these patients had prior, let's say, prior experiences, okay? That on top of the everyday life stress, they're already coming to you on the edge. And, I think both sides have to give a little bit in the conversation. Being rude, again, it's not justified. We can deal with the patients who are nervous.
I think respect goes both ways, especially.
That's right. But again, nobody's going to tolerate the abuse.
And what would you do in that situation when it gets extremely toxic?
Dismiss the patient.
Dismiss the patient.
Yeah, because they need to understand that the whole team is there to help them. And if they don't see the value in it, they can try a different office. Yeah. Those two words, root canal, people are they're going crazy about it. Every time they hear it, it's like a horror story. And I'll tell you this, when it's done properly, and if the case is predictable, patients go about their lives right after the treatment. They can go back to school, work, or again, to the activities that were scheduled. Every once in a while, I get a patient.
So why are patients so terrified of a root canal?
Well, I think there's also the training that goes with it. Depending on the office you go to, depending on the doctor you see, depending on the generation of the doctor.
I think one bad experience can really it pushes you away from going to see a dentist again.
Yeah, previous experiences definitely can shape our, future. However, I think, again, the provider's approach is very important, okay? Are you making that patient comfortable? Are you creating that comfortable atmosphere? That makes a whole difference, because when they're stressed, even the slightest touch, they're anxious about, As long as you can calm them down, they're going to have a good experience. After the treatment, they have to reinforce the tooth, and they forget about getting the crown. And all of a sudden, after 1 year, 2 years, they're coming back saying, "Hey doc, you did this root canal, but it started breaking away." During the appointment that the root canal was rendered, at some point, they pretty much, how do I say it? They probably zoned out and missed the portion where we said, you have to come back for the crowns. Otherwise, this tooth can break. And most of the time, again, that part gets lost in the conversation. And then when the patient appears after a long time, mostly that tooth is damaged in one way or the other. Every visit that we have with the patients, starting with their initial and routine checkups, the most important portion of that whole treatment is the taking x-rays and evaluating the patient. And we always get this question from the patient saying, "Doc, we took the x-ray few months back. Why are we taking new x-rays?" You have to, you're obligated to take x-rays every 6 months because that's the only way we can catch things early. And those cavities, depending on your diet, they can cripple up on you pretty quickly, So,
So when a patient says, "Can I wait to get this cavity filled?" They probably
that is a very dangerous question. Why? Because depending on the patient, their habits, their diet, that small cavity can grow rapidly, okay? Meaning, if the patient is coming and it's a borderline where we're saying, "Hey, we probably need to treat it," and the patient say, "No, I want to give it a time and, come back for it."
So you'd recommend to probably fill it within the next week or within a couple of days?
Unless it's super small, we always recommend taking some kind of action because any action is better than no action. Okay, and these patients, when they come back after a couple months, if they come to their regular checkup, they find out that the once small cavity grew into this huge hole. Now filling is probably out of the picture. Now we have to go with the root canal.
Okay, probably this is more of like a bigger conversation, like a bigger topic. Implants, bridges, partials. First off, what is the difference between all of them?
So, the need for implant, bridge, or partial arises when you lose a tooth, or two, or more. Depending on the case, let's say the patient is only missing one tooth, and the neighboring teeth are perfectly healthy. That's a great case for an implant because you're not dependent on adjacent teeth. You're not cutting the adjacent teeth. You're just working on the edentulous spot to place the implant. But in some cases, let's say patient has a missing tooth, but the space is so small that it's not possible to place an implant. On top of that, let's say the adjacent teeth are severely damaged, then bridge will be a better option. Bridge is when we shave the adjacent teeth and cement this 3-unit crown that reinforces those damaged teeth and also gives you that extra tooth. You gain the extra tooth pretty much.
I also know there's different materials that are used for,
Correct.
Partials, dentures, and crowns.
Materials.
What is the strongest one? I was going to ask.
There are a lot of materials out there.
So which one would you recommend?
For posterior, let's say in the back teeth and the tooth, if the patient is a grinder, I will probably go with something more robust like zirconium. In the interior front teeth, you want to get as much of aesthetics as possible. So you want to go more towards ceramic work. Okay, so Emax is a great option for the front teeth. So everything is decided, everything is pretty much concluded depending on the case, the site of the restoration, and the primary etiology, meaning the cause to that condition.
And in terms of like long term, which type of restoration would
I always tell to my patients, look, if you want investment for the future, I would say go with the implant option, and I'll explain why. Depending on what surprise the life brings to you, you may lose several teeth. God forbid you lose all of your teeth. Those implants, once they are integrated to the bone, it's rock solid. Okay? You're not going to be able to get them out unless you cut around it. If this is so solid, if this is such a good foundation, you can build a lot upon it. Okay? So, God forbid, again, you lose all of your teeth. If you have a couple implants there, we can build all the different options we have. Okay? So, if I was to between partial, bridge, or implant, my go-to is always implant.
Crowns and veneers. What is the difference between the two?
So it's another one of those tacky, what do you call, questions. Patients come, they have a lot going on, and they say, hey doc, I want whitening, I want veneers. Why? Again, because they want to see instant result. But veneers, they're very case selective. Veneer is like a half crown. It's like a fake nail that you put on top of the tooth to pretty much reshape the look of it if you have minor discrepancy, and or close small gaps. Okay, but other than that, 90% of the time, patients who are asking about it, they're not good candidates for them. Why? Because for veneers, you need to have almost no problems going on with your teeth. Okay.
I think I saw trends where you also get like stick-on veneers. Is that something that
Snap-ons? No,
snap-on veneers?
no.
Would you recommend that? I'm sure.
No. It looks, again, they advertise it
sketchy.
so well. They make it look
Press on
amazing. It's a recipe for disaster. Let's say you have broken teeth or you have severely damaged teeth. Crown should be your option. Let's say you're in your 30s and your front teeth have a little bit of gaps and they're a little bit out of shape. Veneer could work. Okay, and those snap-ons, basically what happens is that a company, online company, sends you a tray and you get the mold of your teeth and send it back to them, and they give you this one, it's almost like a aligner type white tray that you put on your teeth. In the beginning, it looks great. Later on, and by later on, I mean within a couple months, you start getting so much work, so much cavities, so much inflammation because your teeth are not breathing. You're pretty much masking the problem. And saliva is not doing its job, getting in there, cleaning that. So all that small cavity, all the minimal problems that you had, now they're growing exponentially, okay? And I'm telling you, within a couple months, once you take off that snap-ons, everything is rotten.
You're going to have more problems, I'm assuming,
Oh, yes. Oh, yes.
than what you had before with your natural
Yes,
teeth.
you have to be very careful. Always seek professional opinion.
Gotcha.
Yeah. Aligners, I actually like aligners because back in the day, I'm talking about 20, 30 years back, the only option that we had was braces, metallic braces, and those are so tough to deal with. Back in the day, I wore braces myself, and I had to watch what I eat because things get stuck. I have to spend a lot of time trying to, clean those braces because it has a lot of those hard to reach areas, and food always gets stuck there. And if you don't brush it properly, clean it properly, it turns into cavities. Another thing is about my conventional braces is that wire, it irritates your tongue, it irritates your lips.
It stains your teeth also, I think, right?
Of course, yeah. And then, every once in a while, it traumatizes your cheeks because all that extra wire is sticking out. Mm-hmm. So as soon as the aligners were introduced and became more popular, it made everything so much simpler. Simple cases and moderate cases can be easily treated with these aligners. And the superiority comes with the easiness of cleaning. It's easy to get them out. It's easy to clean them. Okay. You have very little restriction on your diet. Okay. The only
What can you eat or drink? Can you eat anything, or can you just can you
so
drink coffee?
aligners
water?
are these invisible trays that you put on your teeth. You wear them 22 hours a day. You only get them out to eat and clean them, okay? Which means there's literally not much of a restriction on what you can eat. Unless you're drinking water, these aligners have to be always out of your mouth when you're eating or drinking, okay? Water is a neutral substance, so you can drink it just fine, but anything other than water has stain, has sugar in it, has all these other minerals that can actually affect your teeth.
What inspired you to become a dentist, specifically a general dentist? Because you could have gone to do specialty, right? But
I'll start with the first part of the question. What inspired me? It was my dad. Growing up, I saw his struggle. He did have dental problems. And every once in a while, I would see him, holding his face. This is a universal sign for toothache. And, I think that programmed me into thinking I need to take some kind of action and, alleviate this pain, help people who have the same kind of issue. And luckily, he had his treatment done before I became a dentist, because that could have been a long time.
he would have had to wait a very long time. That is so funny.
Yeah, but luckily, again, he got his treatment. But this urge, this, this, I would say, obsession with becoming a dentist, helping people who are in need of dental care, it stayed with me. And I ended up actually going to the undergrad and grad school, and then doing
And where
some.
did you go for your undergrad and then your
My undergrad I spent at Penn State, and then my grad school I went to University of Pennsylvania. I thought about getting specialized in one or the other areas, like oral surgery or more surgical part of the dentistry. But then the more I thought about it, it seemed like I'm limiting myself. There are people who are okay with doing the same work over and over, and then I wasn't that person. I wanted to do a little bit of everything, a lot of everything. So
flexible?
yeah, I wanted to pretty much be more flexible and give wide array of service in my future career, in my future office.
So my next question for you would probably be, what is one of the, I guess, scariest moments that you had working as a dentist? That you felt maybe the situation was uncontrollable, whether it's a patient in trouble
Sometimes
or
sometimes patients may become a little too aggressive and a little too hostile. So in those cases, you have to make a decision. Are you going to dismiss this patient? Are you going to call the cops? Because it can
have you
happen.
been in those situations where
Yeah,
you'd
we
had to
had
call
one
authority?
patient who was he was intoxicated, and when we denied treatment to him because of his state, he got very upset, and we had to call the cops. And those are and you are scared not for yourself but for your team,
For the
because
people surrounded.
dental setting, it's mainly female population of workers, and they can be easily scared. so you're pretty much in charge. You're captain of the ship. You have to make sure that everybody's safe, everybody's feeling safe. So I think that was the one of those um, scary moments for the team.
And how long have you been working now? How many years?
It's been, I would say, almost 10 years now.
10 years. Wow. That's a lot.
Graduated in 17. Yeah. And then, considering the fact that we go to the clinic 2 years prior to graduation, if you count those years as well, it's actually 10 years now. Yeah.
Wow, that's a lot. I'm sure you have so much experience. Let
Got a
me
little
see.
bit.
I think I noticed that people just don't appreciate how much, like how important it is to actually take care of your teeth. I think you'll see people spend, their money on so many expensive things, taking care of themselves, aesthetically. But when it comes to them actually having a lot of pain, they don't seem to prioritize that.
I
They'll
wanted to
complain a
piggyback
lot.
on that actually because I think it's actual, again, social programming. We are prioritizing the wrong things. I can tell you plenty of patients who will spend thousands of dollars on designer clothes, bags, all these materialistic stuff. But when it comes to their health, they become more and more, I would say, conservative. And
Yeah,
I think that needs to change because we have only one body. Okay.
take care of
We
it.
have to take care of it, And the fact that it gives us those signs, we have to listen to our body, listen
I
to
think
see those signs and react to them.
I think just seeing those emergency patients come in and they're just so in so much pain, like you feel so bad. But at the same time, like they're due for a checkup, or they're due for their 6-month checkup, or and it just you'll kind of like say to yourself,
Right.
you kind of missed a couple appointments, and this could have been treated before you had this much pain. You could have prevented that root canal.
And another thing is that life happens to us all, I do I do understand that, things can happen where, you missed your appointment and stuff. It's okay to miss an appointment, but it's not okay to actually avoid it. Okay. Sometimes patients are actually looking for excuse. Okay.
Oh yeah.
So I think we have to change that because at the end of the day, it's your body and you're responsible for it.